I wish we could just eat all of those foods and live forever, or 93% longer. But let's talk about how all-cause mortality translates to extra years of life, how statistics multiply and not add, and what a small fraction diet actually is to determining our health outcomes. All-cause mortality is a general indicator of health and longevity, and it's used in scientific studies to determine whether or not something is good or bad. It can't establish causality, only correlation. But I only talk about all-cause mortality statistics when causality is established in supportive studies. Very roughly, a 10% reduction in all-cause mortality translates to about a year of extra life, which means that if probabilities added in our example of eating 5 servings of vegetables per day, 2 servings of fruit per day, 1 serving of nuts and seeds per day, 4 servings of legumes per week, and 3 servings of seafood per week, if all of those probabilities added and we did reduce our all-cause mortality by 93%, that would translate to about 9 years and 4 months of extra life. But let's talk about probability. Probabilities multiply. Let's use some round numbers for this example. Let's say I add 2 different foods to my diet that are each known to reduce all-cause mortality risk by 10%. That doesn't, unfortunately, drop my all-cause mortality down to 80% of what it was. But what actually happens is that first food drops my risk down to 90, and then the second food drops it down 10% from there, which is 9, not 10. So it would drop down my risk to 81% of what it was before. And that is only if these 2 different foods work in completely different ways to improve my health. In reality, there's some overlap. In the previous video, I talked about the benefits of adding more vegetables, fruit, legumes, nuts and seeds, and seafood to our diets. Well, vegetables, fruit, nuts and seeds, and legumes have some overlapping nutrients. They all deliver fiber, for example. Fiber is certainly part of the health benefit of those foods. So it means that those reductions in all-cause mortality are not independent. And it's really hard to say exactly what proportion of those benefits is fiber versus other nutrients, which means it's really hard to say, what if I did all of these things? How much would that reduce all-cause mortality? A few studies have tried to measure that. It's in the 40 to 60% range. 4 to 6 extra years of life, though, still impressive. And the final point here is that diet plus lifestyle only add up to determining 40 to 50% of health outcomes. About 30% of your health outcomes is determined by genetics, 10 to 20% is determined by medical care, and about 20% is determined by your social and physical environment. So it's important to keep in mind that there's a lot of things influencing our health that are beyond our control. That doesn't mean it's not worth making changes to improve our diets, but it does mean that a healthy diet and lifestyle isn't everything.